Antenatal assessment. Firstly, we have to take history of the mother, explain to the women what will be done and how she may cooperate, instruct the women to empty her bladder. After that, we have to take height and weight of the mother. We have to arrange 2 trays with the articles, one sterile tray and the articles, fetoscope, pelvimeter, Sims vaginal speculum, sponge holding forceps, Cusco's vaginal speculum, thermometer, anterior posterior vaginal wall retractor, inch tape, a bowl with cotton swabs, sterile gloves, a clean tray containing betadine solution, perineal pad, BP apparatus with stethoscope, a drape sheet with Macintosh. A yellow bin to collect anatomical waste. We have to maintain privacy of the mother. Perform medical hand washing for 15 to 30 seconds by following 7 steps. Apply soap, rub palm to palm. Rub back of the hands. Interlacing of the fingers. Interlocking, thumb rubbing and finger rubbing, knuckles rubbing, rub both wrists and wash hands with clean water. Place a pillow under her head and upper shoulders. Have her arms by her sides. Expose her abdomen from below the breast to the symphysis pubis. Inspect the abdomen for the scars, hernia, linea nigra, stria gravidarum, contour of the abdomen, state of umbilicus and skin condition. After that, we have to measure fundal height and gestational age. We have to draw 2 imaginary lines between symphysis pubis and umbilicus and again between umbilicus and syphistern. On 12 weeks, the uterus will be on level of symphysis pubis. On 16 weeks, midway between symphysis pubis and umbilicus. On 20 weeks, 1 to 2 finger breadth below umbilicus. On 24 weeks, level of umbilicus. On 28 weeks, 3 finger breadth above the umbilicus. 32 weeks, halfway between umbilicus and xiphoid process. 36 weeks at level of xiphoid process. 40 weeks 2 to 3-finger breadth below the xiphoid process. Here we can see how we have to measure gestational age: 12 weeks, 16 weeks, 20 weeks, 24 weeks, 28 weeks, 32 weeks, 36 weeks. Here, how to measure fundal height and abdominal girth. Here we have two methods to measure fundal height. One, by using measuring tape. Place zero line of the tape, measure on the fundal area to the symphysis pubis. Stretch the tape across the contour of the symphysis pubis. Second method, by using pelvimeter, also called caliper method. Place one tip of the caliper tip at the top fundus and the other tip on the superior border of the symphysis pubis. Read the measurement on the centimeter scale located on the arch close to the joint. The number of centimeters should be equal. Measure the abdominal girth. We'll measure the abdominal girth by encircling the woman's abdomen with a tape measure at the level of the umbilicus. For palpation, we have to perform Leopold maneuvers, take written consent from the mother, explain procedure to the patient and promote comfort. Be sure your hands are warm before beginning to palpate. For technique of palpation, use the flat palmar surface of fingers and not fingertips. First maneuver is fundal palpation. Face the woman's head. Place your hands on the sides of the fundus. Palpate for size, shape, consistency and mobility of fetal part. Second maneuver is lateral palpation. Continue to face the woman's head. Place your hands on both sides of the uterus about midway between the symphysis pubis and the fundus. Apply pressure with one hand against the side of the uterus. Palpate the other side of the abdomen with the examining fingers from the midline to the lateral side and from the fundus using smooth pressure and rotatory movements. Repeat the procedure for examination of opposite side of the abdomen. Third maneuver is Paulik grip. Continue to face the woman's. Grasp the portion of the lower abdomen immediately above the symphysis pubis between the thumb and middle finger of one of your hand. Fourth maneuver is the pelvic palpation. Turn the face the woman's feet and has her knees bent. Press deeply with your fingertips into the lower abdomen and move them towards the pelvic inlet. The hands converse around the presenting part when head is not engaged. For auscultation, place fetoscope or stethoscope over the convex portion of fetus closest to the interior uterine wall. Redress the woman. Make her comfortable. Inform the mother of your findings. Replace articles and wash hands. Replace the articles. Record in the patient's chart the time, findings, and remarks if any. Instruct the mother for the follow-up care. Thank you.